Welcome to another exciting episode of the BYU Management Society's Learn from Professional series. Whether you're exploring different career paths or ready to dive into your next big opportunity, we're here to provide the guidance and insights that will help you thrive. Today, we have the privilege of hearing from a true expert in the healthcare industry, Dominique Swain, a board-certified physician's assistant at Colorado Springs Urological Associates in Colorado Springs. She grew up in Michigan and completed her undergraduate education at Central Michigan University, where she received her Bachelor of Science in Biomedical Sciences. She then went on to receive her Master of Health Sciences and Physician Assistant degree from Duke University School of Medicine in Durham, North Carolina. Dominique began working in urology soon after graduation and thoroughly enjoys this field of interest of medicine. Prior to joining Colorado Springs Urological Associates, she worked in a urology practice in the greater Denver area. She is board certified by the National Commission on Certification of Physician's Assistants and is currently a member of the American Academy of Physician Assistants, the American Urological Association, the Sexual Medicine Society of North America, and the Rocky Mountain Urological Society. Dominique is experienced in all areas of urology and has specialized expertise in men's health. She provides personalized care tailored to each patient. Dominique values the trust patients place in her and takes time to stay up to date on the best practices in urology, helping to provide the highest level of patient care. In her free time, in addition to becoming a new mom of a beautiful baby girl, Dominique enjoys spending time with her family and friends, traveling and enjoying the beautiful Colorado outdoors. So welcome, Dominique.
Thank you. Thank you for the introduction.
So um, we appreciate you joining us today and your willingness to share your valuable time and expertise. We're eager to hear from your experiences and wisdom. So let's dive right in.
Mhm.
You've made an incredible impact in your field. What was it that first sparked your interest in pursuing a career in the healthcare industry? Was there a defining moment or influence that set you on this path?
Yeah, so I have pretty much, I can remember way back always being interested in healthcare. My mom is a nurse, my dad is a physician, my older sister went to medical school. So I was kind of, born into heading into medicine. I actually worked in medical records. I filed records after school in high school was my, after school job. So kind of born into it. There was a PA that worked at the office I worked at, and that's kind of how I got introduced to the career. And pretty much right after I graduated high school, I knew that's what I wanted to do was become a physician assistant.
That's terrific. So everyone's journey is unique. Can you walk us through your career path and decision to become a physician's assistant, and what were some of the pivotal decisions or experiences that helped you to get where you are today?
Yeah, so you already kind of read off, a nice bio about me. I did my 4-year bachelor's degree at Central Michigan University. In that, you do a lot of prereqs for PA school. A lot of schools, require different prerequisite courses, but anatomy, physiology, biology. Um, I, got my healthcare experience. That's a prerequisite to go to PA school. You have to have some sort of patient care experience. So I became a certified nurse's assistant. I worked in a few skilled nursing facilities, and I became a medical assistant and worked in a family practice office. Um, a lot of shadowing of PAs, some volunteer experience through different healthcare organizations. I helped out with the Lions Club, hospice. I was a volunteer for, visiting hospice patients. So that's kind of some of the, qualifications or skills I learned before becoming a PA.
It sounds like in order to get accepted into the PA school, there's some prerequisites that you have to obtain and some extra work that you put into it.
Yes, yeah. In addition to, I mean, most prereqs are, pretty hard classes, organic chemistry, those types of things. But in addition to that, you also have to have all those patient care hours. So it's a lot of work to get all of that done, especially if you're trying to do it within that 4-year undergrad period to get all of your hours plus your bachelor's degree. So a lot
So,
of people, do their bachelor's and then take a year or two off to get their patient care experience before applying to PA school, but you
oh,
can do
I
it
see.
all at once.
And could you tell us about the difference between a physician's assistant and a nurse practitioner?
They're very, very similar. They're both, advanced practice providers. The term, it's a little antiquated now. We don't use it as much, but like a mid-level provider. So the difference is basically the way you get there. Nurse practitioners are nurses first, and then they go on to get their master's in nurse practitioner school. PAs sort of follow a little bit more of like the pre-med pathway. They, do like a pre-med undergrad and then go on to PA school. But I had actually a nurse in my PA program. She opted to go to PA school instead of nurse practitioner school.
Okay, all right, that's interesting. So you mentioned that you had a PA in one of the jobs that you had, and she kind of gave you some advice. So she maybe mentored you a little bit into what's required to become a PA?
A little bit, yeah. I mean, I mostly more so just through observation and, watching how he practiced, and that's how I, kind of became familiar with the field.
Okay. All right, so I'm sure you've heard a lot of advice, a lot of career advice along the way, but what's the most powerful piece of advice that someone has shared with you about building a successful career?
Definitely, as a PA, you're not trained, you don't go through the 4-year medical school, the residency that, a physician would go through. They compare PA school to drinking through a fire hose. I mean, you're just learning things so quickly. So one of my preceptors in PA school that, I did one of my rotations with, his big recommendation was don't wait until you feel ready, start doing things before you're comfortable with it. So, not necessarily being reckless about things, but recognizing that, growth lives outside of your comfort zone and you need to, just jump into things in order to become comfortable.
Sure. So, when you are a PA or you're going through and getting your master's, do you specialize at that point, or do you specialize once you're through PA school?
Once you're through PA school, so PA school, you learn general medicine. I mean, you go through each specialty. You have rotations in women's health. You learn OBGYN, pediatrics. So you kind of go through each area of medicine, but you don't specialize. So once I graduated PA school, I applied to pretty much every and any job. I really, I had some classmates that were specific. I want to work in the ER, or I want to work in surgery. I was open to pretty much anything. I just happened to interview and like this job in a urology practice. So now that's what I've been doing for the last 7 years. I could technically leave that job today and start working tomorrow in surgery or something else, but I'd need a lot of, on the job training and probably a lot of studying and
Sure.
reminding myself about those areas of medicine.
So I'm curious to learn more about the work that you do on a day-to-day basis and your role there at Colorado Springs Urological Associates.
So I come into the clinic. I'm outpatient based only, so I don't go. Urology is a surgical subspecialty, but I'm not utilized in the operating room. So I work in the clinic Monday through Friday. My first patient's at 8:30 in the morning. I see patients all the way till 4 o'clock in the afternoon. Usually about 15 to 20 patients a day, and it can be a wide range of you know presenting illnesses. Coming in for refills of medications, prostate problems, prostate cancer, bladder cancer, low testosterone. There's, a wide range of things I treat. As you said in my bio, I primarily focus on, men's urologic care, but I do see some women for kidney stones. Women get bladder cancer. So I see a wide array of different things throughout my day. And that's also includes procedures. I do cystoscopies, which is a camera to look into the bladder, to pull out stents from a kidney stone surgery. I do testosterone pellet insertions. So there's a wide range of things I do throughout the day.
Okay, well, it sounds like those are all pretty serious things. And I know that the work that you do is very impactful. And can you tell me about how it feels to have a significant impact on the lives of people?
Yeah, I mean, I went into this. Most people choose to go into healthcare because they want to help people and make an impact. I often, a lot of my patients I've been seeing for several years, so it's nice to, build a rapport with people, see them back. I, may start with one condition and we make it to a different condition that I start treating someone for. Things evolve over time. I see a lot of people on, I try to remind myself this could be this person's worst day ever. They're finding out they have prostate cancer or, something else is going on. So it's important to realize, that it's a sensitive thing that you're taking care of. And it makes a big impact when, patients come back to me and thank me or hug me that, I made a big difference for them.
Well, that's terrific. Um, so Dominique, a career is not always a straight path. I know it hasn't been for my career. It's ebbed and flowed, and lots of things have happened as I've continued to grow. But have you encountered any significant obstacles in your career? And if you did, how did you face and overcome those challenges?
Yeah, of course, there's always obstacles in any career. So one of the big things I dealt with was actually during COVID. The company I worked for had to furlough a bunch of staff because we kind of shut down operations. So I was out of work for about 3 months
Hmm.
during COVID, which was a tough time. And that's actually how I found the job down here in Colorado Springs. As you mentioned, I previously worked up in Denver. So I overcame it by I just kind of moved on and found something new, and it ended up working out perfectly. I moved down here with my husband, and we love it, and I love my new position. So it all ended up working out, but definitely a big obstacle to overcome.
Sure. That's a tough time. So, beyond your formal education, you mentioned some on-the-job training that you did
Mhm.
at senior center or senior living facilities and others. Um, Tell me about advanced learning and how important that is to your career, continuing education that you might have to do.
Yeah. So as a PA, to be maintain your board certification through the National Commission of PAs. You have to get 100 hours of continuing medical education every 2 years. So I'm constantly, you can either go to conferences in person, there's virtual things, there's journal articles you can read. So I have to stay up to date, and medicine's ever evolving. That's why they call it practicing medicine. We're always practicing and coming up with new things to do. So I have to stay up to date on that. And actually, I'm currently going through my recertification for my PA license. So I have to take, basically like a quiz every quarter for the next 2 years. I have to
I
do
see.
these questions that range from not just urology, but everything. So I'm kind of relearning a lot of things that I've not practiced in a while.
Okay. So a lot of continuing education. That's a
Mhm.
lot of hours.
Yeah.
And I know all about that. We have to do it every single year.
Yes.
So Dominique, tell me about what are the most rewarding aspects of your profession? I mean, you mentioned, having a big impact on people's lives, but what are some of those most rewarding aspects? And then also, what do you consider to be challenges? I mean, that you deal with on a day-to-day basis?
Yeah, I mean, rewarding is definitely the impact I can make in patients' lives, and my job. Luckily, I do a lot of more like lifestyle medicine. I fortunately don't deal a lot with the cancer side of things, so I'm improving people's day to day lives with testosterone management, and I really enjoy the infertility aspect. Helping people achieve a pregnancy is an awesome thing. People will come back with their babies a year later, and hey, you guys helped us have this baby. So I deal with male infertility, so that's a really impactful part of my job.
I see.
Challenges, burnout you hear about a lot in medicine. It's constantly, how do we sustain seeing enough patients to be productive and, keep the business running, but, still having time to make relationships with patients and not make patients feel rushed. So burnout is a big problem in healthcare right now. Um, Time management is another, just with how many patients I see a day, balancing the clinical duties, the documentation, the follow-up, and then, still making sure I take care of myself. So there definitely can be some challenges within healthcare as well.
I see. So, um, with those physicians, with physicians' assistants, and those challenges that you stated, what do you think separates the very best physicians' assistants from those that excel from maybe those that don't?
Yeah. I mean, most PAs I've met have, are excelling in their career. We got here because we worked hard, and you don't go to PA school if you're not strong-willed and smart. And but I think people that stand out in the field definitely are adaptable. Like I said, medicine is constantly evolving, so you've got to stay kind of flexible. Know the new protocols, change gears, shift gears easily, especially if you're changing from specialty to specialty. You've got to be adaptable. Another big, thing that I think PAs that are successful have is strong communication skills. You're constantly, as a PA, you work with a physician for the most part. You have to collaborate. You're working with nurses, medical assistants, front desk staff, schedulers. I mean, you have a lot of people making the factory work in healthcare. So you've got to have strong communication skills, in addition to, of course, communicating with patients effectively.
Yes. Communication is can be difficult sometimes, I imagine, especially if you have to give some bad news to somebody, but it's
Of
uh, but
course.
it's essential. Um, so the world is constantly evolving. The medical profession, as you stated, is always evolving. What trends or shifts are currently shaping your industry now?
There's definitely been, a shift after COVID. We're doing a lot more telemedicine care and virtual care. So that's, something that you kind of have to learn and have a little bit of a virtual bedside manner if you're doing telemedicine visits. Um, there's been a shift in medicine for, a good shift in more preventative medicine rather than, focusing on how can I fix something that's already happened, how can we prevent things from happening, weight loss, exercise, more holistic care for patients. And then of course, there's always changes with health equity and cultural things that we have to, cultural sensitivity, language barriers, inclusive care. So there's a lot of changes that can happen with that as well.
Mhm. So there's trends, there's shifts that occur. Uh, in addition to continuing education, it sounds like you've got 100 CE hours that you have to do every 2 years. But what are your recommendations for young people to not only stay ahead of the curve, maybe as a physician's assistant, but also any profession that they might be getting into, things that they can do to stay ahead of the curve?
I mean, definitely finding a mentor or, someone that you can shadow or figure out, is this the career I want to go into? And how are these people successful? And how can I mirror that or even improve upon that? Um, and then, if you're early in the thought process of maybe physician assistant is something I'd like to consider, researching, the schools and prerequisites now so that hey, this is the school I want to go to. These are the prereqs they require, and I got to make sure I meet those requirements.
So, for someone that is, and you just mentioned it, doing research, right? Doing a lot of research to prepare for that. But if someone's already done their physician's assistant training, they've got that certification, and now they're ready to jumpstart their career, what advice would you give to them? And what do you think are some of the most important things to do to focus on, from day one?
I think definitely if you're already a PA and you're looking for your first job, finding a job that has a supportive collaborating physician is really important. So, someone that's going to advocate for you and, give you some flexibility, but also be there if you need help. Um, I also think casting a wide net is important. I'm glad, I never would have thought I would land in a urology job, but I think being open to different specialties, and I think it's more important the people you work with, the flexibility you have, the schedule you have, more so than necessarily the area of expertise or area of medicine that you get,
Hmm.
a job in.
So the importance of having a great team and a great mentors.
Yes.
So if someone is exploring a career in this field, they're exploring becoming a physician's assistant, what are some of the steps that they can take to learn more about becoming a physician assistant and understand the profession before saying, okay, now I'm going to commit myself to all this education, time,
Right.
and money?
So I would definitely recommend the AAPA, the American Academy of Physician Assistants. Um, I think that's a .org that you can go to. They have a ton of information on, PAs, what they are, what the, requirements are. Again, I would recommend shadowing someone, finding a mentor. There's also a physician assistant forum, a little bit more of a, not as formal of a website as AAPA is. It's more of like a community of people that engage and, advice on PA program applications, clinical rotation. So a lot of PAs post on there, and I think that would be a good place to look or even post and ask questions.
Mhm. Okay. So balance is something that many young professionals struggle with. It can be tough. As a new mother, I'm sure that this is very important to you, important to your baby, important to your husband. What
Mhm.
advice would you give someone that wants to thrive in their career, but also live a fulfilling, balanced life?
I think setting boundaries, just like, with any job, setting boundaries on, these are the hours I'll see patients and, I need some time to catch up on notes and there's constantly things coming in as a PA. You're ordering labs, you're ordering imaging, so it's not just those 15 to 20 patients I see in a day, it's the 100 patients I saw last week that all their results are coming in. So it's important to have time to see all those results throughout the day, have some administrative time as well, or you end up taking work home, which I don't think is much of an option for me now with a newborn. So it's important to become efficient, but also have a job that values balance and will help you, maintain that balance.
Well, it sounds, Dominique, I know that you make a big impact in the Colorado Springs area and a positive impact on your profession. Um, what advice would you give to those that are passionate about making a difference in their careers?
I think, if particularly if you're going into healthcare, understanding that, your impact isn't always dramatic. You're not always doing, life-saving CPR every day. It's, the little things that you do for patients that make a big impact, and, maybe small changes you make over time that, a patient I saw as a new patient 5 years ago, if I talk to them today, they'll, tell me, hey, you've made such a difference. And over time, I see that, things didn't happen overnight. So every patient, kind of gives you an opportunity to make a difference.
So you talked about the importance of finding a mentor or mentors that you can ask questions of and learn from. But networking,
Mhm.
oftentimes that's a real key to success. And can you tell me a little bit about how important networking is to your field and the best way that you found to build meaningful connections?
Yeah, I think, like you said, networking is important in pretty much any field. It's important in life. Um, Starting with, undergraduate education, getting, familiar with your professors in PA school, making friends, and your classmates become your colleagues at some point. Your, faculty, your preceptors during rotations. I think it's important to network with all of those people. Down the road, you may be, looking for a new job, or it's helpful to know people in other specialties. Even being just in the Colorado Springs area, knowing people in gastroenterology, women's health, infectious disease, having a relationship with other healthcare professionals in your area, so I can call up another doc and say, hey, I had a question about this, do you think I should refer this patient to you?
Mhm.
And then within your field, I think it's even maybe more important to have networking opportunities. Like we mentioned, all those hours I have to get every 2 years. I go to a lot of conferences. I go to a lot of the same conferences every year, just being in a smaller specialty. And I've met people, networked, have phone numbers that I can call. I'll even have patients tell me, hey, I'm moving to Indiana. Do you know anyone that's good in urology there that I can start seeing? And, oh yeah, I'll have you see Kristen or whoever in that area. So I think it's incredibly important to network and know people, not only in your specialty, but just
But
in
outside.
healthcare as a whole.
Sure. So before we wrap up, do you have any other career or life advice that you wish that someone would have shared with you when you were just beginning your professional journey?
I think a lot of this we've hit on already. I'll kind of go back to what, the advice I said that was good for me that I got, that you don't always have to know everything. Things come over time. You don't have to know the answer, but you can always know where to look or know who to ask. Confidence comes over time. Especially as a new PA, sometimes you feel like some imposter syndrome that, I don't know what I'm doing yet, but it comes with time, and you eventually become an expert in your field. So I think I'll reiterate that advice that, confidence comes with time.
Okay, I like that. I like that. Um, well, Dominique, we want to thank you again. We truly appreciate the time that you've taken to share your valuable insights with us. Your story, your advice will undoubtedly help shape the careers of many young adults who are just getting started on their journeys. As we close, remember the journey to success doesn't always have to be walked alone. You can reach out to seasoned professionals like Dominique for informational interviews, whether that's through your own connections or by asking for an introduction from someone in your network. And to help you prepare for those powerful conversations, we encourage you to watch the video on our website conducting informational interviews. I think that's very helpful. So start building your career. your future today by taking the first step toward connecting with mentors who can guide you to success. So Dominique, again, thank you so much.
Thank
You're
you.
incredible, and I know you do incredible work, and we really appreciate that.
Well, thank you. Yeah, thanks for being here, and glad I hopefully this helps some people.
Okay. All right. Have a good day.
Thanks.